Hey everybody, this is Jim Prussack from the Pain PT, and today we're going to talk about managing emotions and chronic pain. And I want to talk to you about two words called emotion regulation, or ER. Many of you have probably not heard that term before, but I'm going to show you today how important it is with chronic pain and how we manage our emotions. We know chronic pain takes a huge toll on us. It affects us on many levels. We know that chronic pain is also partly emotional in nature. It's not just a physical sensation we feel, but it has an emotional component to it. We have the research to support this. The emotional centers of the brain are highly linked with the development of chronic pain and also the persistence of chronic pain. And so, we're going to talk about today is called emotional intelligence. And one of the categories here is managing emotions. We're going to talk about that. That's what's called emotion regulation. And emotion regulation is a psychological term, and what it really involves here are two different ways that we can work with our emotions. The first way is called antecedent focused ER. What this is how we deal with situations before an emotion is triggered. We could call this cognitive reappraisal or reframing. So, as an example, if we're in a stressful situation or we're having a spike in our pain, if we can reappraise or reframe the situation as something being bad or something being terrible or thinking of it in the worst case way, when we can reframe it, we may be able to limit the amount of emotion that gets triggered, either fear or frustration or anger. So, this is one of the ways we can regulate our emotions. And it's actually a really healthy way and probably the best way to deal with emotions. But when emotion gets triggered, which many times it does, then we go to number two, which is response focused emotion regulation. All emotions are normal, but when they get triggered, we need to understand there are good ways and bad ways to deal with our emotions, and they have real and lasting effects on us physically. And I'm going to talk to you here today more about that. So, there's some literature out there in the science. This is a systematic review, and what it found was that maladaptive response focused emotion regulation, which means how we deal with our emotions once they're triggered, may be an important risk factor in the development and maintenance of chronic pain. And I'm going to break this down a little bit here with some of the studies that were included. So let's take anger, for example. Dr. Sarno was the first person to identify anger as being a link for chronic pain and other health issues in the body. And in particular, suppressed and repressed anger, or rage, he called it. We have some studies here that you see on the page that show exactly that. That when we suppress or repress or hold our anger in, once it's been activated in us, that has been shown to increase physical pain in the body and also increase pain behaviors. We also have some evidence to show that when we hold our anger in, we have greater asthma symptoms. So it's another physical symptom that can come about because of suppressing or repressing our emotions. I'm going to show you even more physical sort of consequences from suppressing and repressing our emotions. These two have to do with alcohol. The first one here looked at our emotional intelligence and how we deal with regulating our emotions in people with alcohol dependence. And what they found that people who have poor emotion regulation skills had greater pain severities. And in another more interesting study that came out early this year, 2019, was quite interesting in that they looked at employees who forced themselves to smile at work and be happy in front of customers or to hide their feelings of negative emotions. These employees were shown to be at risk for heavier drinking after work. So really what we're finding is when we hold in and we suppress and repress our emotions, it has lasting effects on us. And I'm going to show you there's also links between emotion regulation and breast cancer, as well as chronic fatigue. So it's not just chronic pain, but it's across the board. We even have some early research to show that emotion suppression can have an increased risk for earlier death, including death from cancer. This is a 12-year follow-up study. But we need more work. We need more science to really show and pair out this linkage between suppressing our emotions and physical problems. So really, what do we need to do? We need to learn how to self-regulate our emotions, emotional self-regulation skills. I'm going to show you here a couple studies that just highlight where we need to be headed when we're dealing with the emotional side of chronic pain. So we know that putting feelings into words produces therapeutic effects in the brain. This is a study out of UCLA. What it found was that when we put words to how we were feeling emotionally, our amygdala, the part of the brain that helps process emotions, became less active when we labeled the feeling. And another part of the brain, the prefrontal cortex, which I talk a lot about in some of my other videos and its relationship to pain, became more active, which is a good thing. So we're finding there's a therapeutic effect in the brain when we can acknowledge and put our feelings into words. So this is a healthy behavior in emotion regulation. Another study done by Dr. Howard Schubiner and his colleagues looked at emotional awareness and expression therapy with people with fibromyalgia. And this is a randomized controlled trial. And what they found was that emotional awareness and expression therapy was more effective than fibromyalgia education, and it surpassed cognitive behavioral therapy and pain reduction. So this is another piece of evidence showing the importance of how we deal with our emotions, because they are a big piece of chronic pain. So hopefully this shed a little light on what's called emotion regulation, something many people haven't heard of before. And you can learn more about this at some of my other pain videos here at the Pain PT. If you have any questions, always reach out to me. I'm here for any assistance and help, and we'll talk to you soon.